Hello, everybody. This is Syed Parvez. I'm Program Director of Vision Care Technology, and I'm presenting this Vision Care Technology program information session for all of you today who are here and who are interested to join our program. Uh, Applications are accepted at this time, and you're welcome to go to our web page of the Vision Care Technology and download an application, and you can view different other information for the contact lens for the vision care technology program. uh, we have two faculties. The first one is Syed Parvez. He is a program director, which I am the program director for the vision care technology. My other colleague is Sonia Gentry. She is the program clinical coordinator. Uh, Students finally, when they complete this program, they will graduate in associate and applied science degree in vision care technology. This is a 2 years course with 5 semesters. And the job of the ophthalmology technician is to assist the ophthalmologist or the optometrist in the clinics and do various kind of testing for the patient, including the scribing and all other uh, requirements on the patient when you visit an eye care uh, facility or a clinic, such as going there for getting your eyeglasses or getting an eye exam, or for any other reason, getting glasses even. The eye technician can also work in optometrist or ophthalmologist or optical labs or in a showroom for the optical companies, because they are fully trained in most of these things, and also they can work as a contact lens technicians. Uh, the vision care technology program flyer is available on our website. You can download that flyer. It will show you various subjects which we teach in the 5 semesters uh, during the course. These 5 semesters, they include uh, most of the majority of the things which are used to become an ophthalmic technician and to certify as a ophthalmic technician from Joint Commission for Allied Health Personnel in Ophthalmology. And this certification is valid all over America. When you get this certification after you pass our course, you will be allowed to take directly this exam, and you will become uh, a certified ophthalmic technician, which is called a certified ophthalmic assistant. This is the first level. And from there, you can keep on advancing. If you do not want to work as an ophthalmic technician, you have chances to go into an optometry school and complete the next 2 years. Many subjects which you are being taught in this vision care technology courses, they are also transferred to UIW and other universities where you want to pursue a degree in optometry to become yourself an optometrist doctor or an MD doctor. You have to take a MCAT examination after you complete your baccalaureate degree in science, uh, and you will be one day you can become one day a medical doctor who can specialize further in ophthalmology. So there are various books which are required for this. They're also described in this PowerPoint, and you have to buy those books uh, and for this course. And then in this course, you have to wear all the students have to wear scrubs, and we will provide you the information from where you get the scrubs in the market. The eye care professional, they are called ophthalmic assistant, technician, technologist. They work with the optician, optometrist, low vision specialist. They work with orthoptist. They are ophthalmologist who work as an eye care professional, ophthalmic photographer who only does photography of the eye externally, and inside of the eye also he takes photographs. Ophthalmic surgical assistants also, you can work in any facility where these surgical surgeries take place. Uh, there are three levels for the certification of an ophthalmic assistant. First, you do the COA, it's called Certified Ophthalmic Assistant. The second level is Certified Ophthalmic Technician, and the highest level is COMT, which is Ophthalmic Technologist. You can work in private practices, ophthalmologist offices, optometry offices, outpatient centers, and hospitals. The demands have been growing up uh, as well, and you have to have a good aptitude. You have to uh, sit and stand for moderate amounts of time. You should have a big speak. You should have a good speaking ability, and you work as a team, and you are flexible, and you work on the patient records, and you will be taught all of this while during the course. The duty of the duty and responsibilities includes, which is listed here, but let me tell you in short, this will be everything you're required to do in eye clinic, um, uh, 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 as a technician. Like you will be working with patients and the examination rooms. So everything which is present in the examination, this is your responsibility to complete everything there, like to keep everything in working order. And when a patient arrives, you have to take a patient history, patient workup. You have to measure visual acuity and all the tests done before that. So in that case, like you do about a 75% of the work on the patient, which uh, gives time to the doctors to work up more when they see the patient actually speaking. Uh, there are special testing and skills also you can learn, which is A scan and B scan biometry, which looks in the size of the eyeball, and the required applanation tonometry for the glaucoma. You can also do another very recent, like a modern technology has been introduced, which is called optical coherence tomography. It takes the pictures of your retina inside and gives you a good view of the retina, that how the retina is performing at this time. You can test eyeglasses. You can write a prescription for a patient on which a signature of an optometrist or an ophthalmologist has to be done for the prescription to be handed over to the patient. Uh, then you provide total quality patient care to the patient. You give the correct information. You treat the patient with compassion and dignity. You can work as a dispensing optician in any optical shop. Most of the clinics, they have optical shops in which you can work there as an optician also, because you're qualified and you'll be taught everything regarding glasses also during your course. Uh, and have all different kinds of measurements in this picture you can see. uh, you can also be trained as an optical manufacturing technician in the optical labs, because we will teach you each and everything before you leave our course, so that whichever field you want to join and in this business as an ophthalmic assistant, you can go there and join it with all these qualifications. The work areas, as you know, like I have already told you, it's in medical practices, offices of optometrists and ophthalmologists, large optical retail sale places also. You can also work as an ophthalmic surgical assistant in various surgical centers which perform real surgeries on the eye. Like suppose you may have heard about the cataract, glaucoma, or any other emergency surgeries are done on the eye. You can work in emergency rooms also as ophthalmic surgical assistant, uh, attached with uh, a doctor, ophthalmic surgeon, and they work in various kind of surgeries. You can assist the doctor in cataract, retina, corneal, laser surgeries in the clinic, and also some minor surgeries or plastic surgeries done in the clinics, as well as in the optical, like in the surgical centers. And you have to perform uh, post-operative work on the patients also, to change the bandages, put eye drops, eye ointments, and everything required. In this slide, you can see the doctor operating through the microscope, and the assistant is passing the instruments and doing various things with the doctor. In this also, the work areas is hospitals, medical centers, physician clinics. You can work as an ophthalmic photographer also in bigger eye clinics where they have most of the things available there. And one of the most important things which they do is called fluorescein angiography. And this fluorescein angiography uh, normally is done in a doctor's office which are competent enough to do this kind of testing by giving an IV dye in the vein and then passing through. And when the dye passes through the retina, the photographer can take pictures and see if there is any leakage of the blood vessels inside the retina, which can happen in diabetes, and is called a diabetic retinopathy. Here you can see in the picture the technician is inserting a needle and also injecting the patient with that dye. Now this picture you can see this inside of the retina, uh, inside of the eye, and you can see the retinal blood vessels. The blood vessels are veins and arteries, and this central picture you can see there, the blood vessel arrive, they enter the eyeball through um, through the optic nerve in the center of the eye, of the optic nerve. This is a normal retina, but on the right side you see a picture of diabetic retinopathy with the small spots. You can see the white spots, and these are the spots done. They happen into the eye and been recorded by the angiographer, who's called ophthalmic photographer is also called an angiographer. So he records it, and the doctor can see this, and then he can treat these with laser or any other treatment which he wants to do. In this one, they are employed also, the photographer is employed in the ophthalmologist offices in which they do all of these kind of activity. Specialties in ophthalmology, there are various specialties. There's a comprehensive ophthalmologist who does everything. There's a corneal external diseases ophthalmologist who works on the eyes, the cornea, sclera conjunctiva in the eyelids, and the cataract and the refractive surgeries are done. Uh, the cataracts are done mostly in the surgical centers, and the refractive surgeries they're done in the clinics, and you can assist those doctors there. Glaucoma, the whole glaucoma disease can be treated by an ophthalmologist, and then he does different kind of surgeries and different kind of testing on that, in which you are a team member and you help the doctor in doing those things. There is other inflammation which happen in the eyes, uh, uveitis and ocular immunology. That's also being practiced, and the ocular immunology especially happens, have to be treated by an ophthalmologist, and this kind of disease can happen in people who have rheumatic disease going on in the bones. So these are the various specialties which are done. Then there is vitreoretinal diseases which involve the inside of the eye. The plastic surgeries are done by the plastic eye surgeons. They can do cosmetic surgeries. They can reconstruct the whole orbit or the eyelids, which have a little laceration, suppose in an accident or something. They work on that, and the technicians always assist them. In the neuro-ophthalmology business also, there is a neuro-ophthalmologist which is in demand these days too much because there are very few in San Antonio. There, you can assist that doctor who does a various kind of specialized tests which are not done anywhere else. You can also become an ophthalmic pathologist, which are also a demanding field, and you can also work there with the pathologist to prepare slides and do some histopathology work also with the ophthalmic pathologist. Most of the time, the pathologists have their own staff, so you don't even have to work there if you're. But if he needs your assistance, you will be taught ophthalmic pathology also during this course, and so you will be able to know what is going on. In the end, now I'm going to give you various kinds of various web addresses, and you can look at that. One of the very important ones is ophthalmology technician hourly rates, and then the ophthalmologist salaries. Another thing, let me tell you, in the end is that our field of this ophthalmic technology is in demand at this time. Uh, Most of our majority of our students who are working here with us, as soon as they graduate, even before that, they have been offered jobs, and 100% of the graduates who have graduated from this program of St. Philip's College have already been employed. There's none of our graduates who is unemployed. They've been offered good jobs, and then when you go on a job, we get experience, then you can negotiate and move around, and you can go in any other clinic. Now, this certification and the technology which we teach you, uh, this one will be helpful to you in the sense that you can work in any city in state of Texas, or in any state in the United States. Everywhere this will be accepted. There are few states where you have to take their own exam to take another certification of that state, which are possibly is California and Florida. But majority of the states, they don't require anything. They just require your degree and your certification. So you are very well qualified, and also qualified enough that if at one time you think that you want to become an optometrist. Several of the ophthalmic technicians who have passed this course before, from this college or from another college, they have already uh, been accepted in the optometry programs to become an optometrist. And I know one of my students, he is just completed his baccalaureate in science subjects, and he's taking the medical college admission test, which is called MCAT, to become himself as an MD doctor. So there is great opportunities waiting for you to happen, but it's up to you to go and grab it. And before you have to go and grab it, you have to come to St. Philip's College to a program and apply. The application dates are open now until the 30th July. Uh, so please, if you're interested, give us a call and go to our website of St. Philip's College first. And on that St. Philip's College website, you type in the address, your query as vision care technology, and that will take you to our website. And on that website, all information for you and the telephone number that given. And thank you very much for giving your time here. Now, if there are any questions in the question answer session, I'll be very happy to answer you, or you can send me an email, which is also given on my on the website of our Vision Care Technology Program webpage. Thank you very much, and have a nice and safe day today. Thank you.